and go.
Okay, my name is Cheryl Adams. I'm from Bangor, Maine and Husson University. This was my student research group last year that did this study on the CPM. And we knew there was a lot of controversy about whether to use it or not, and most therapists believe it's effective. So we decided to look at the literature. We only looked at studies that did early mobilization in comparison, compared to the old days when they used to cast the other knee. So we wanted to see if today with aggressive PT early after surgery, if the CPM was still beneficial or not. And basically we found that, well, we looked at a lot of studies and we came down to 18 that met our inclusion criteria for quality and for all of the subjects getting exercise, and then one group getting CPM and one group not getting CPM. And most of them had the same surgeon within the study and the same total knee replacement. And what we found was there was a short-term benefit. 7 out of the 14 studies that looked at short-term knee flexion did find a significant difference in those that had CPM compared to those who didn't. However, that difference was really small. Most clinicians say the difference should be greater than 8 or 10 degrees to be really clinically relevant, and in most groups it was 5 degrees or less. There was a Chinese study that had 21.5 degrees, but they didn't have very good documentation necessarily of their methods, and they had a lot longer hospital stay than we see in the US. So we did find some moderate evidence for short-term knee flexion, but that went away shortly after discharge. So there was nothing after a few weeks after discharge that was significantly different in terms of range of motion, function. There was no difference in length of hospital stay, edema, DVTs, pulmonary evidence. There wasn't any evidence about cost being different, really. But we did see that there were 2 out of 3 studies that looked at the need for manipulations under anesthesia following surgery, and 2 of those studies showed that there were significantly more manipulations in the group that did not have CPM. So that might be one of the benefits. But overall, we didn't really see that the benefits outweigh the cost of using it. As long as you have aggressive physical therapy right away after surgery, it doesn't seem to make that much difference with the CPM now. And it's a hard thing to sell because most clinicians and most patients believe it helps, so most of the orthopedic surgeons are still using them in our country. But we don't see any evidence, and as a matter of fact, there's a Cochrane systematic review that was published in the spring last year that showed pretty much the same results as our systematic review. And that's held to pretty high standards. So you can go ahead and look at that 2014 Cochrane systematic review and you'll see similar results. Thank you, our friends to the north.